Okay, I think we're ready to get started. So welcome everyone to today's webinar where we're going to talk about how to make your plastic surgery and aesthetics practice stand out by going virtual. My name is Ashley Faber and I do product marketing here at Clara. And we decided to do this webinar because while the aesthetics and plastic surgery industry is really always in a unique position in the healthcare space, it's really especially the case right now during COVID-19 pandemic and everything that's going on. So we want to make sure that we had a chance to speak to this audience directly because we know that your needs can be a little bit different than the rest of your colleagues in the healthcare space. And today we're going to show you how to navigate both the challenges and opportunities in front of you to gain a competitive edge and grow through digital workflows. And if you're not familiar with Clara, if you could just go to the next slide, please, Lawrence. If you're not familiar with Clara, that's really what we're all about, is helping practices grow. And we do that with our patient engagement platform that works end-to-end across the care journey to provide patients with a modern and convenient experience they demand, and also just helping them connect with your practice and making sure that it's effortless for you to do that at every turn. So today I'm joined by Lawrence Spethmann from Clara, and I'll let him introduce himself as well as our special guest today.
I'm Lawrence Spethmann. I've been working with medical practices in my capacity here at Clara for 4 years now. Specifically, I partner with a lot of our aesthetic-focused practices, so dermatologists and plastic surgeons, med spas, helping them figure out how to make their business better, grow faster, make them also more efficient through digital experiences. And I'm really honored that one of our clients, Dr. Nick Slenkovich, who runs the Colorado Plastic Surgery Center, is here today joining us, talking about his experience, what he's done. Certainly when I had a conversation with him, I considered him to be a thought leader, and he's very well known in his area for being a forward-thinking surgeon. So thank you, Dr. Slenkovich, for joining us.
Absolutely. Thank you.
All right. Thank you, Lawrence. So within the next 40 minutes or so, we will discuss the state of the aesthetics industry today, provide strategies on how to stay competitive with a stellar patient experience, explain what digital workflows could look like for your practice, and then we'll have a discussion with Dr. Slenkovich on how he has successfully driven revenue through digital channels and used telemedicine in his practice to be successful, in some tips and tricks, that lessons learned from Colorado plastic surgery. And then we'll have some time for questions at the end, so please enter your questions into the Q&A throughout the presentation, and we'll be sure to get to them at the end. So before we dive in, we do want to take a quick poll and make things a little interactive here. So our first question for you is, have you implemented digital workflows in your practice? And really what this could be is sending patient intake digitally versus filling out paper forms, or requesting payment online, communicating with patients via text instead of phone call. All of those things really qualify. So I'm just going to launch the poll here. Respond, let us know. It's either yes, most or all of your workflows are digital, yes, but only for telemedicine, or no, still doing everything by paper. Okay. All right, interesting. All right, I'm going to end the poll here. Okay. And then I think, Lawrence, well, I'll let you take it from here to talk about the state of the aesthetics industry today.
Absolutely. So COVID-19 pandemic has presented its own set of challenges for aesthetics practices, particularly because the space relies heavily on elective procedures and face-to-face interaction. One of the ways in which that came up was that a lot of surgical practices weren't able to do any procedures for 3 months, or in some cases longer. So, of course, all of this, the nationwide shutdowns, the orders to pause elective procedures lead to a significant revenue loss. For example, specialty practices, including plastic surgery, dermatology, ophthalmology, ortho, and cardio, lost a lot of revenue because elective procedures make up so much of their revenue. So A study actually conducted in Korea in April found that 95% of plastic surgery clinics lost revenue, with the majority of respondents losing up to 39% of sales year on year. One of the other things to consider here is that, of course, a lot of plastic surgeons are well known, they are internationally well known, and restrictions or further restrictions on international travel make it even more difficult for them to service their international clients as well, for instance. So what's been really, really interesting is how quickly things have rebounded as stay-at-home orders have shifted and lifted. So with folks spending more time seeing themselves on camera and in Zoom meetings, there's been an increase in demand for injectables and other non-invasive cosmetic treatments. And this is something that anecdotally I can definitely confirm with a lot of my clients, specifically on the med spa and dermatology side. They've seen a lot of uptick in demand. So the American Society of Plastic Surgeons conducted a survey last month to gauge plastic surgery interest during the pandemic, and 49% of people who haven't had plastic surgery said that they would get it in the future, and 29% of people that participated in the survey indicated specific treatments they're interested in, like rhinoplasty, facelifts, and breast augmentation. So we've also seen plastic surgeons come out and say that they're busier than ever. For example, Dr. Samela Sunder from Beverly Hills said that she's busier than ever today. She's booked out longer than ever, even before she was before the pandemic. And then there's also Rod Rorick, a cosmetic surgeon in Texas, who said he's seeing more than normal, to the point that he could probably start operating 6 days a week if he wanted to, which is really, really incredible and a really good sign for the industry overall. Another market signal that we looked at, and this is something that I see a lot also in dealing with other specialties, is that totally separate from the pandemic, there's a growing popularity of aesthetics across other specialties. That's of course because a lot of especially the injectables and some of the sort of lighter cosmetic treatments can be done by practices in other specialties. And of course, that's a really good additional revenue driver for those practices as well. So according to the American Academy of Cosmetic Surgery, it's 1,600 members fall into an array of specialties that include but aren't limited to ophthalmology, OB/GYN, and general surgery. So even family medicine physicians are getting a piece of the pie. There was a 2015 survey from the American Academy of Family Physicians that basically showed 3.7% of respondents offering Botox services in their family medicine clinics. Needless to say, there's a growing demand and increasing popularity in aesthetic procedures, but of course, that also puts the practices that are specialized in aesthetic services in the position of needing to differentiate themselves and needing to differentiate to consumers and patients why they should be the ones to gain the business of those patients. So necessity is the mother of invention. Of course, we as a tech company and we as a startup, we live that every day, but I think especially in this space, it applies quite well. The necessity, of course, is the demand that we've just highlighted. And there's still a lot of uncertainty about what this necessity will look like if there's a second wave and more stay-at-home orders during the fall and winter. I had a client in California call me, a dermatology practice, who basically asked me whether we know what will happen in California and how our clients are reacting to the growing case numbers. And so while that's really, really hard to predict, unfortunately, we don't have a crystal ball, you can still focus on the invention that will give you a leg up no matter what's going to happen with the pandemic, and that will help you stand out long after the pandemic is over.
Great. So on that note, we want to know, is your schedule booked up with as many appointments as you had before COVID-19? So I'm just going to launch this poll. So yes, more than before COVID-19, just as many, or no? Okay. So definitely leaning towards the yes, so echoing some of what we heard before. To end this poll, I think we can move on to the next section, Lawrence.
One of the things that I want to comment on here is that I've had conversations with a lot of my clients that basically said they used the time in during the lockdown to make improvements to their business, but also really build a pipeline of patients that were ready to receive treatment as soon as the lockdown orders ended to basically create that full schedule as well. So that might be a contributing factor here too. How to stay competitive with a stellar patient experience. So back to invention, right? The invention here is your patient experience. In this section, we're going to talk about why the patient experience is so important and how you can improve your customer service to really meet the modern and evolving needs of your patients. I want to preface this by saying, if you look at this list, we're going to be talking about three key parts. One, better customer service and communication, meaning patients can more easily get in touch with you, respond to your outreach. Two, telemedicine as a long-term service. So there's been an uptick in telemedicine during the pandemic, but it's here to stay for the long term. And then the last piece here is better intake procedures for all types of visits. So avoiding waiting rooms, in-person paperwork, insurance card collection if you do reconstructive procedures, and more. I do want to pause here and say you might be wondering why we're not talking about marketing, why are we not talking about ads? At this point in the aesthetic space especially, these are table stakes for aesthetics practices. So really what we want to encourage you to do is push beyond the barrier of the table stakes and think more critically about what you can do to become special to your patients and their point of view, and how to give them that concierge experience. So first, let's talk about communication. Simply put, patients value convenience and customer service. They want to be able to contact their physicians easily. As many of you are acutely aware, if a patient is looking at cosmetic procedures, you're likely not the only provider that they're reaching out to. So being able to give a convenient method of outreach that is familiar to them, like for example, texting, and being able to create really, really good response times. This is something that we collaborate with teams on a lot. We give insights reports to every team that we work with on the response times that their teams have on messaging with their patients to make sure that we can provide that outstanding customer service. The other piece is that 96% of patient complaints are around customer service and communication, not really actually clinical care. So a really, really crucial thing to keep in mind as you also, for example, look at your reviews that might not be so favorable, or feedback that you've gotten from patients, really focusing on improving the areas of customer service and communication. The next piece is, I think from our perspective, we want to be able to offer patients multiple ways of getting in touch with you. So thinking a little bit about this digital front door concept, what are ways that are synchronous, like the phone or a video visit where you can communicate with the patient at the same time, and what are ways that are asynchronous, like messaging, that you can use to your advantage? What we've seen is texting is really, really important. And a lot of offices actually, and we learned this in the onboarding process all the time, a lot of doctors' offices will have a sort of texting capability where the nurse has a cell phone and then patients after their procedures can text that nurse questions. Why? Because text messages have a 98% open rate. The response rate is 209% times higher than the phone, email, or Facebook. So 90% of SMS messages are read within 3 minutes, meaning this is a really, really, really great channel to integrate into your practice, not just for Q&A after surgery, but maybe also before. And in general, for everything, always keep your patient in mind as you're coming up with these strategies. One of the things that we of course see, and I mentioned the example of having a cell phone for a nurse to answer questions, is keep in mind HIPAA compliance. You want to make sure that the entire organization can access this communication with the patient because it is clinically relevant, and it's helpful to have a tool that lets the entire organization have a transparency into this customer communication, and that it's all secure and encrypted. And further, there are tools like Clara that can provide automation that is geared towards engaging the patient and still making that interaction feel personal. Two concrete examples where we see this happening in our practices is checking in on pain levels automatically with patients 24 hours after surgery. A lot of the times this can be done via phone call as well, but maybe the patient is sleeping or resting. So having an automated outreach to say, hey, how are you feeling? Let us know how your pain is on a scale from 1 to 10, and here are some instructions on how to take care of your incision site. Another idea here that we've seen work quite well for practices is for injectables or some cosmetic procedures where patients might want to share their results. You can have an automatic message go out to patients after 3 days or a week, asking them for a selfie so that you could also use those results to share on your Instagram or your social media. What's really critical here is this is maybe a small idea, but think about the difference between getting an email for a request for a selfie versus a text for a request for a selfie. It's way easier to text a picture than email a picture. Aside from improving communication, how else can you serve your patients and meet their needs, especially if we hit a second wave and you have to stop elective in-person procedures? So there's no denying that people are prioritizing self-care and skincare during quarantine. I have been on many Zoom calls with my sister and myself wearing a face mask. So if you don't already, you should really consider selling skincare products that they can buy online and or pick up in person from your practice. If you have some type of shipping arrangement, that's great. If you can offer special deals to help turn over your inventory, I think that'll make a really, really big difference. And then of course, engage with them on social media with at-home skincare tips. So you're basically top of mind when the restrictions are lifted and you've already created that relationship with them, especially a tool like Instagram, which has this incredibly sort of personal feeling messaging element to it, can be a really, really great way to engage with patients and then also convert them into appointments for the practice once it reopens. And think about the visits that you can have if there's another lockdown, which leads us to the next piece of the patient experience, and that's telemedicine visits.
All right. So we want to know, coming into this section, what do you think of telemedicine? We know this is a hot topic right now. Let's launch this poll. Do you think it's a temporary fix during the crisis? Do you think it's useful sometimes, but you don't really see it helping the practice grow? Or it can help sustain the business long term? A lot of people are following the trends now and saying long term. But Lawrence, what do you think?
Well, what we see, of course, in the best practices, the sort of most forward-thinking practices have recognized, especially due to COVID, that it sustains them long term. It's an integral part of their business. It's not just a fad. And I'm going to be very curious to see what our guest says about it in our Q&A. Now, I think that a lot of people see the value of telemedicine as a long-term solution. That's the right approach. If we look at the data behind it, there are surveys that went out that show patients like telehealth visits. 93% are valuing the quality and convenience that real-time video visits provide, and 84% are saying that video visits improve their relationship with their provider, which I think is really, really important to recognize. A lot of the time, there's the tendency in this market to say patients value in-person interaction more than a interaction over video or via technology. But this data definitely challenges that. So I would urge everybody to think a little bit more critically about what's the right time and the place for the in-person interaction, and what's the right time and place for the interaction via a telehealth visit. So we think telemedicine is here to stay. Seema Verma, the CMS administrator, said as well, there's absolutely no going back. The signals that we've seen, especially recently from CMS, are very much in line with this trend. There's a new telehealth bill in the US House of Representatives that was released a couple of weeks ago to make some telehealth expansions in Medicare that require a change in law permanent. There's also a recent Health Affairs blog where Seema Verma made these comments. Of course, many of your procedures don't require Medicare reimbursements, but the important thing here is that CMS is responding to the demand from patients. And in that sense, I think that's a really good thing to keep in mind, because patients have gotten used to doing telemedicine, and not just with you, but with all of their doctors. So you kind of have to be on board. All this is to say that you need to think about how telemedicine will become a normal part of your practice. That also means designating specific appointment types, such as telemedicine only for example, initial consultations. So For many aesthetic procedures, you can do a consultation in person, but you can also, in some cases, do it over telemedicine. So since with cosmetic consultations, you don't really have to worry about the coverage side of things yet. You can make sure the visit gets paid up front, for example, and you can proceed with the consultation. If it's economically feasible for both the patient and the provider, because it might not actually convert to an actual surgery. So you kind of need to think a little bit about where payment makes sense. But if the patient is open to it, you might be able to convert more interested patients to an initial consultation by doing it virtually because they don't even need to leave the house. Thinking a little bit down the line about post-procedure follow-ups, of course, you have patients, if they got a Botox injection or a lip filler, you can do a telehealth visit to check in how everything looks or if the injection sites look good. I think this is a really good example of just really premium high-level customer service that would be really difficult to do if patients had to come in again for a visit. So especially for post-ops that don't have many complications, it's almost like, why wouldn't you do it this way? Research has shown time and time again that there's no clinical difference in outcomes really. Offering telehealth visits should be a normal part of your practice. So I think another perspective here is prescription refills. This is specifically relevant for the dermatology space, I'd say. If you have telehealth visits that are a normal part of your practice, it'll save time for everybody involved, physicians, staff, and patients, if they're set at the right time. And I think you'll also be able to offer better care with less interruptions, and you'll be able to expand your reach more on that later. The third and last component of the patient experience that we think about a lot is patient intake. This has been part of every single conversation I've had with practices over the last 2 months, really thinking about things like insurance collection specifically for reconstructive procedures, gender confirmation surgeries, or burn treatment. Talking a little bit about intake forms and consent forms. Contactless care is a really big buzzword these days, and for good reason. Patients and staff alike expect a safe experience to limit COVID-19 exposures. So how can we use technology to, even though patients are in the office, maybe give them a digital first experience where they're filling out their forms on their cell phone. They don't need to touch anything. Maybe they get an automatic text message the night before their appointment asking them to fill out a COVID pre-screening consent form. So as a result, a lot of practices are trying to eliminate their waiting rooms and are trying to collect everything electronically ahead of the visit. Having patients wait in cars is a really common thing that we've heard. The way that we see it, more and more patients will expect this even after the need for contactless care is behind us because they will have basically gotten used to filling out everything on the phone. I had clients twice this week tell me, we always tell patients to print out download the forms, print them out, and then email them back to us, but they never do it, right? Because that requires 5 or 6 steps that patients in their busy lives just don't want to do. So if we can create these call to actions, so to speak, for patients to do this ahead of time or to do it right before their visit and they can do it on their smartphone, I think the chances of getting these forms completed is a lot higher. There's also something to be said for if you can give patients their consent forms ahead of time, they have more time to read them and really consider them. And if you have a patient who's filled out all of their consent forms 3 days ahead of time, it's likely that they're also more likely to show up to their visits. Another example here is telemedicine links sent automatically to patients to provide a more seamless experience. Particularly when we get into the automated flows, this is super helpful to alleviate the burden of your staff to need to call a patient and walk them through how to get onto a telemedicine visit. Even more importantly, I think this is also your chance to make sure that patients adequately prepare for their visits. One really specific example is reminding patients a week ahead of time to stop taking blood thinners before their surgery. You need to think about human nature. What's the highest likelihood that patients will follow instructions? If they need a sheet of paper that they get a couple weeks beforehand, like where is that sheet of paper? I have a stack of paper right now in my room that I would never find that in. They need to be reminded at the right time for the specific type of procedure via a channel that they would actually look at. For a lot of our customers, we leverage text messaging for this because it just works so well. And I think it's a patient's responsibility, of course, to be prepared, but it benefits everyone in the practice for them to come in prepared because they'll have better outcomes and your team will ultimately have less work. Back to necessity is the mother of invention, quote of the day. You need to reinvent your patient experience in order to thrive long term. Fortunately, you can do all of this while digitizing your workflows. So we're just going to talk a little bit about the administrative burdens in the process for digitizing workflows. Just some high-level numbers here. Traditional workflows aren't really helping the bottom line. You know, almost every practice that I talk to has had some sort of change in staffing, if not reduction in staffing. So if you think about physicians, almost 50% of physicians' time is spent doing busy work, even with an EHR that's highly automated, while 27% is spent seeing actual patients. You know, 3 hours per day is wasted per staff member on phone tag, just calling patients, calling them back, you know, receiving calls, leaving voicemails. That's wasted administrative time, and that means that you're losing revenue. In fact, $50,000 in revenue is lost annually per physician on average because of busy work that falls into these categories. So with digital workflows, we can recover lost revenue and be more efficient with our time and see more patients. So I think that's really, really important. A lot of, you know, I think a lot of people have trouble buying into the concept of efficiency because, of course, time spent is time spent. But ultimately, if we can drive the time in our practices away from things like scanning forms that patients signed in person, and we can put them towards things like managing social media, engaging patients when they're in the office, making them feel comfortable, getting them a water, getting them situated, then we can create healthier practices that are more profitable and prosper in the long term. So let's look at what digital workflows actually look like. This is just an example of something that we do for our clients. So we look at the entire patient workflow. So we categorize that into pre-visit, visit, and post-visit. All of these can be digitized with a solution like Clara, except for, of course, for an in-person visit. There are a couple other solutions out there that do parts of this, but we sort of take the holistic approach, especially from the communication angle. You know, otherwise, all of these touch points can be turned into an automated text message that are customized for each patient depending on their visit type and other factors. And I want to pause here to say, there might be skeptics out there that say automated messages, is it really that personal? Patients really like that I'm reaching out one-on-one. You still are reaching out one-on-one. It is your practice that's connecting individually with that patient, specifically for the procedure that they're scheduled for, sending them a reminder that they need to follow some type of instruction. And I think if we look at follow-up messaging, it's especially relevant in aesthetics because some injectables require repeat appointments so patients get the right results or maintain the right results. So being able to automate that stuff lets you help encourage the repeat business, which in the software world, we of course call recurring revenue. Doing so is not only going to help the patient experience, but it'll also help save your staff a ton of time and money. And as we look at how the world is changing, COVID is a really good example. Before COVID, patients didn't need to fill out a consent form just to make sure that they don't have any COVID symptoms. Now that's a practice that a lot of practices are following. And as a result, that's taken more staff time away from things that generate revenue. So you'll have the same workflows for in-person and telemedicine visits, and I think that's really, really key. We want to encourage you to think about where can we create these parallel workflows that work regardless of whether patients are being seen in telemedicine or in person. You know, make sure that all of your patient communication, administrative, medical, is brought into one place and digitized. A lot of practices are using voice over IP systems. Clara is a good example of something that integrates with phone systems to basically take all of that communication, whether you do get voicemails or not, and takes the website communication, the phone communication, text messaging communication, and kind of puts it in one place. You know, even voicemails can be recorded and transcribed. A lot of voice over IP systems do that. Unifying all elements of your practice's communication into a single platform will let everybody collaborate as a team and provide excellent patient service. And I think this is an example of where, for example, having a cell phone that a nurse will respond to text messages to is a little bit of a limitation, because a lot of the times patient requests, you know, have a different sense of urgency, and it's helpful if we can apply job sharing to these messages that come from patients, especially when they're about post-op follow-up. So you'll basically reduce the complexity and save time for your staff, because you can really have your entire team looking at the same thing. And now I would love to welcome Dr. Nick Slenkovich to talk about his practice.
Okay. All right. So if I got my mic on, can you hear?
All good.
Yes, we can hear you.
You know, that was really helpful. This whole concept of digitizing, both for your processes and communications within the practice, but also your content, whether that's on social media or otherwise, I think is a big theme. And I appreciate you inviting me to speak here. And I've worked with Lawrence on setting up Clara for our practice. And I found it be super helpful for secure digital communications, the text messaging, and even the video communications, especially because, you know, we work to get people off of email, work to get people off of text messages on their personal phones. It's not protected. And more importantly, it's really not documented. So, you know, if you have one staff person in the front or a nurse or someone else that receives a message, they tell you about it, you don't know what that communication has been. It may have been on call, et cetera. Clara is, the reason we went with Clara is it's a centralized point for that at least it's its own shadow medical record. And I really like that it's got all the communications there on the patient side and a separate kind of clinic side where you can redirect and you have the personal messages or the behind the scenes messages from one provider to another about what you think is going on or what you may do. So we really use it as a good on-call communication tool for us, and work as hard as we can. We've just started with it this year during COVID to get off of any personal text message or any personal emails, even to our work email addresses. And so that, I think, is a good transition to what Lauren asked me to talk about, which is the theme of the effort that it takes to digitize. And it takes real buy-in investment of the staff, the physician, and everyone on the team, and your tech support, whoever it's going to be, your vendors in the case of Clara or whatever other digital tech you're using. And it's for sure here to stay. When you were asking your questions, your poll questions, for sure, this is the digitized world is here to stay. I love that summary slide you put up, Lawrence, that had every single step of the process from kind of intake initially through communication, active treatment, and to follow up. I actually screenshotted it on my phone while you were talking, because I'm like, man, that's a good model to see. Where can we digitize? And if we haven't, where do we need to? So Lauren asked me to speak a little bit about, I think ultimately virtual consultation was one of the big things. And for me, that's something that we were forced into with COVID and has been a game changer for us. And so I'm happy to talk about that. And Lawrence, if there's something else or if there are questions or comments you have, please absolutely chime in. But, you know, this also takes a lot of energy and buy-in to get it to work. But I wrote a few notes and I felt like benefits really that I see are ultimately a great connection, sometimes a better connection with patients virtually than in person. And if you're not already doing virtual consultations and you think that's total BS, the reality is that has been the case, and our conversions were through the roof. We converted nearly every patient during the time we did consultations during COVID virtually while we were shut down and had no choice. We opened back up, and now we've elected to continue virtual consultations and have got Fridays for me now are a virtual day, and for my patient coordinators as well, a virtual day. And we found it to be a great experience for patients, in particular because of the connection. Like right now, I'm looking straight at you. I've got no distractions. I didn't just run into the room trying to remember what was on your chart and what the patient coordinator reminded me of. I've got a computer on my desk with your information. I've digitally had your photographs that you've submitted to me sent in, and your intake paperwork. And I've been able to prepare myself while my patient coordinator has been prepping you for me to join their Zoom meeting. And so when I jump in, I feel like I kind of have a head start and I already know you, and I'm laser focused on getting a direct connection. Hey, how's it going? How are you doing through COVID? How's your family doing, et cetera? And many times that's a much more comfortable place for a patient to be in their own home, or I've had nurses in the emergency room in the hospital in the back room with their friends. I've had people at work and in other places, but oftentimes it's at home. And the barrier to how hard it is for someone to come into an office and get naked and be examined, or to just show themselves in front of the staff. If we think about it for ourselves, that's a pretty high barrier. And that is lower via virtual consultation. It seems to be more of a homey, personal connection that we're able to make. So I would absolutely recommend that if you haven't done it already, the digital virtual consultations are something that are necessary, really. I think they're going to be much more expected. And now that we have the choice to have people back in the office, we do that for some of our consultations if the patient chooses to do that, number one. Or if we're going to use simulation technology where we need to get them in front of our Vector 3D machine, take a picture and show them their simulation, it just seems to be a little easier and not create an extra visit if we have those people in person, but we can do it virtually. One of the other big benefits is we've got people that it's a little harder for them to come in for consultation if they're across the state, or they're from out of town, or if they're flying in. And by getting your processes perfected to do this, it opens that up to where it's now a natural, it's not uncomfortable, or it's not like, well, yeah, I'm in the back, I'm going to pull up my phone and we're going to do it the last second. And we take it quite seriously in terms of our process. So let me explain a little bit how we do our virtual consultation process. We invest a lot of time, training, and energy into starting the patient relationship in a really very intentional and very kind of thoughtful and caring way. So our people that call in and contact our practice, which some people actually call, many times it's through DM on Instagram, or it's through some other medium, or text message, or a chat form, or a inquiry form on a website, all of the above. And we reach out to them and don't try and do initial sales call initially. Our front office will reach out to them or answer the phone, ask what they're interested in, and immediately within, maximum length of that call would be 5 minutes, set up a 20-minute appointment with our patient coordinators on their schedule. And the way that works is our patient coordinator schedules are open, and they just get their schedule filled up by our front office staff that are looking through leads, and our patient coordinators look through leads as well, but they're doing the same thing, is they're scheduling a phone call. And the benefit we've found of scheduling a phone call for is that nobody answers a phone, or people aren't available. It's so hard to connect. So if we just have a call back, or you call in, you try and hit the patient coordinator live in real time, there's a lot of misses, and it's really changed from our patient coordinators. They have a curious lead that wants to talk to them. They're calling in, they're getting voicemail, not getting through. So the scheduling has really helped. Plus, it's much more efficient. They know what they've got in front of them. And for that 20-minute phone call, they're going through information to really find out if that person understands and has a good idea what their goals are, if they're physically prepared in terms of health status, et cetera, if it's in plastic surgery, body contouring for weight, or whatever those things might be. Also emotionally, do they understand what this is? Are they going to be prepared for what it takes to get through surgery? Are they mature? Do they have insight into, it's not a perfect thing in terms of a guarantee or outcome, et cetera. And then financially, are they prepared for what the cost is, and give them a good idea what that cost range is? Then they have them submit photos in digitally to us to prepare for consultation. So that's sort of a pre-consultation. And then we do the virtual consultation or in-person consultation. That's all been set up ahead of time. So then on a consultation day, so for example, I've got a consultation day virtually from home tomorrow. My patient coordinator's at home. I'm at home. Right now, I'm looking into a camera. I've got a light in front of me. Those are things that are really helpful. It can just be a good quality webcam. It can be the camera on your laptop, and I definitely do that, but I work to get it positioned up a little higher when I'm doing that, or work to sit in front of a window if I don't have a light sitting in front of me, so that it doesn't just look haphazard and distracting. The presentation, and you can Google, Zoom meeting and how to set up your room for that. But it does make a difference in your professional presentation. And then my patient coordinator then starts that consultation call with them, goes through the initial process of checking in on what their goals are, tells them risks of procedure, potential procedures, et cetera. Then I come in and I do my part of the consultation. So if you're not doing it, which I believe many of you already are doing this, or your doc is already doing this, I think you need to be. And I think, so that's the digital consultation side of it. But I think the digital content side is equally as important. We saw Rod Roerick quoted here, and Lawrence presented others saying demand is up. Google searches are way up right now for the procedures that we do. Right now, Google pay-per-click ads are cheap because they're clicking through with many leads. And so right now, if you're not seeing an increase in demand and doing an increased number of surgeries, you're missing it. You should be. And I know that people out there want what you do and value your expertise and skill as a professional, and they're looking to connect with you. So if you're not full, then I think your digital content is where I would go next. You can pay people to market for you. You can pay people to help you with social media. I've chosen to go kind of all in on social media, and you definitely don't have to go all in, but the benefits of presenting yourself on social media are you can develop a direct connection. You bypass the marketers, you bypass the yellow pages or the pay-per-click ads or Real Self or whatever it is. And guess what? How helpful is Real Self now? It sucks. It lost its Google rankings. How helpful are the yellow pages? Half of you don't even know what the yellow pages are. So my point is that billboards and paid advertisement, they're only there for the period of time that they're there. They don't create a connection. You're not showing your individual personality, expertise, credentials, and just who you are as a person. And people choose you because of all of those things when they get to know you. Why not take advantage of that as part of the recruitment process for steering patients to your practice? And it makes it far easier than for those to become advocates for you on social media in the digital content realm after their patient, if they came in from that to start with. So those are my basic thoughts. I'm happy to chime in or answer any questions or that you have, or even Ashley. And I can certainly talk about how we've digitized, how we've done social media, any of that. But that's kind of my thoughts and an overview.
Thank you. Sorry, I had a little internet snafu. I'm back. I would love to just, I think you touched on a little bit. You touched on a lot of the high level things that we had discussed earlier. So thank you for sharing that. One of the things that I would love for you to speak to is how have your patients responded to engaging more digitally with you and with your practice?
Yeah, we have this golden opportunity now where it's wide open and people are more and more expecting it and appreciating it. But this is a silver lining of the pandemic, right? Is that there's not much choice in many cases, and so now that not much choice, and so therefore they're accepting digital communications more readily. They're getting more used to it. They're getting more personal. If I'm on my phone and I'm FaceTiming with my daughter 5 years ago or 10 years ago, it's a little weird. You're not really comfortable doing that. You're like, I don't know, it doesn't seem all that personal. But over the last few years, we do it so much that it's getting more like real life. In fact, now that we're on Zoom all the time, it's getting even closer. It's definitely not the same as being in person, but it's that much better than it has been in the past. So the short answer to your question is, I think it's expected and it's necessary. And it's absolutely wide open for us to use digital communication.
That's helpful to know. I have another question for you. So I think you've given a lot of really, really strong examples of how you have digitized your workflows and how it's really changed your practice for the better long term. And I think you've sort of interspersed advice here and there, and that's really, really valuable for everybody joining. But I'd love to hear sort of what are your top 3 tips in terms of advice that you have for other aesthetic practices that are looking to become more digital, that haven't gone as far as you have?
Well, if you're not the doc, the doc's got to get, kind of come to Jesus and have buy-in, because honestly, I think it's really hard if you don't have buy-in of the doc. So whatever it is it takes to get buy-in of the doc, you're going to be fighting up a hill battle if they're really not bought in. Now, the natural disinclination, there's lots of them. One is, all the resistances we had since I've been a baby, I'm in my 50s. I mean, but what I mean by baby is, from early in my adult awareness of what goes on in the business world, it was wrong to do a yellow page ad by the traditionalists. It was wrong to have a website, et cetera, et cetera. Okay, well, let's accept that we all want that now. I don't want to have to randomly look up an academic paper to find a professional. I want to have all that in front of me. So first of all, it's just the way of the world. It's expected by the people who want your services. And number two is the resistance to how hard it is to get started. None of us are great communicators. All of us suck on camera. None of us sound good to start with. It's very hard to start. But guess what? Everybody sucks when they start. It just doesn't matter who you are. Joe Rogan, or, you think of some person who's a phenomenal and comfortable communicator, and they will tell you that their first podcast was horrible, that they were terrible to start. And so there is no remedy for the fact that it just takes doing it, making yourself go through it and do it before you become comfortable doing selfie videos about your procedures or transmitting energy, et cetera. So I would say it's critically important to get through that curve. Number two is you've got to be you to be authentic. You can't try and act and be Dr. Miami. Dr. Miami is a friend of mine. Michael's a great guy, but I don't want to have that bullshit he does. He jumps around, dances, and does skits. But guess what? He loves doing that. So it's authentic when he does it. It's a good thing he loves doing it, because guess what? He does it. So now he's hooked into, he has to do it because people expect that, and that's why they follow him. So people are only going to follow you for you being you. You better go ahead and be you. And the third part of that is, you can see, so my energy level right now is pretty high, right? And I'm doing that very intentionally because I've done so many talking head videos where I don't want to watch them. So I certainly wouldn't think anybody else would want to watch them. And so transmitting energy to the recipient of the content takes a lot. If it's a phone and it's not live, like right now we are live talking to each other. I know you're recording this, and I know the intended audience is actually also recorded, so not live. So we've got like two barriers there. One is we're not in the same room. That takes increasing your energy level to transmit an effective communication. Two, it's not live for most of us. Now, for those reasons I said, we're getting better at like feeling live or getting a better connection even through digital communication. So, but I'm intentionally speaking a bit louder. I'm projecting. I am trying to project through with more energy very intentionally, because otherwise it's going to be really boring. And so so it's training, it's practice, it's intention. But when I'm going around, we're talking about doing an orgasm treatment or a injectable or whatever it is. I'm working with someone on my staff, we're doing something, and somebody's holding the camera and we're doing a piece on social or recording a video. I said, that was great. Now just triple your energy till you feel ridiculously stupid and do it over again, because it's going to be perfect. And then they do it and they laugh a little. And because they're laughing and we get a couple of stupid outtakes, because you're not really going to get recording that stop. That's usually the best part of the whole thing. And so it just takes practice, being authentically. In other words, no one's perfect, doesn't matter, but you need to be relatable to establish a connection. So if I can do it, anybody can do it. I'm an old guy, right? Everybody grows up this day. I wasn't born with a cell phone in my hand. I didn't grow up with, digital porn as a teenager. Okay. Now most people that are adults these days have. So in some ways I have an advantage over you guys, but the disadvantage is I wasn't born with this stuff. And it is something that we're living with. It's for sure here to stay. Again, people want what you do, respect you as a professional, and like you as a person. So you've got to get that out there. And I think, that's where technology and digital content and social media gives us a huge advantage today.
Wow. I couldn't say anything better. I'm going to take a lot of that advice from you back to myself. I really, really, really appreciate for you to join us today and provide all that insight. I think we got more insight and advice and exciting tips than we could have hoped for. So thank you so much for joining us.
Hey, I'm happy to end this by just, I think do you have me on this Zoom call? Can you put this up?
Mm-hmm.
Yeah.
Let's do it. I think
I don't know. I'm looking at my monitor
requested to you.
I'll just show you, and if it doesn't work, it doesn't work. And I could certainly explain it, and I somewhat did. Show you how I'm doing what I'm doing. Start my video. I'm going to say, okay. All right, it's showing. I think it is showing. Mm-hmm. So I just have my laptop. When I'm doing, so this is the phone that I'm holding in my hand. I'm showing you what I'm looking at. So here's my Zoom meeting, but here's where I would have your pictures, et cetera, if we were doing a virtual consultation. And the way I'm looking straight into the camera is I'm actually looking at a teleprompter. And, these things are a couple $100 now, and maybe a little bit more, but they start at that range, and it's got a little monitor on it. So that's actually mirroring the monitor on my phone. So I've got a camera through that is my source for Zoom, and then I'm looking on a monitor. Now, honestly, that's stupid. You don't need to do this, but I am showing you how I do this. This is a light. This is just a softbox light that's over my head. And okay, that's it. You can turn that off. But my point in showing that is I also am working to do a podcast, and I've got a half dozen episodes released, and I haven't released a podcast yet, but the podcast is long form. It's another great way to find connection with an audience that really gets to learn about you if they have to hear you talk for 20 minutes or interview someone for 30 minutes, whatever it is. And so part of this is I'm kind of a geek, and I come from a TV background where I did this stuff this is one of my failings. I like this stuff, and we're setting up a podcast. It's definitely not necessary to do this, but those principles of being intentional about how you sound, there's not a huge echo in the room or kids crying in the background, whatever it is. By the way, those things are really important. Where your screen is pointing, that is usually I'm looking at people at virtual consult where they've shown me their pictures, where they've taken them. 90% of the time, that's it. But occasionally they haven't been able to, or they want to show me something, they're undressing on the camera, and that's fine. And that you can do it primarily that way too. But then it becomes even more important, and you're having a very personal, private conversation, that there aren't kids running behind you in the background, and that your screen isn't where other people can see it. And those, hopefully that all comes through subconsciously, that you just don't have it. But those are big distractors from your ability to connect to someone about something super private and very confidential if you're not careful of those things in virtual consultation. So obviously this is overkill for most. It's not necessary, but those principles of what are you doing to create the environment, just like when you go into a consult room, that room, you've created an environment in that room just the same. And this is the virtual version of that. It's important that you pay attention to kind of how that comes across. Sound, light, video, all of those are important. Sound is actually extremely important. I see Lawrence is wearing a headset. That works great. Whatever you do for audio, make sure you come across well with audio, because that's, I think it's equally as important as the video and the rest. It just makes it much easier to participate.
Awesome. Thank you so much for sharing that. I think it's really, really helpful to see your setup, and I was hoping you were going to show that. So thank you so much, Dr. Nick, for participating and for providing all of your advice. I think it's going to be really critical to everybody here today and everybody who will be watching the webinar after. We've gone a little bit over, so I'm not sure we have time for questions. As in usual fashion, we did this last time as well, actually. But in case anybody has any questions, feel free to reach out to us either via Clara.com, the website, or to me personally, l.spethmann@clara.com. We're here for you. We want to help you figure out how to make your aesthetic business successful. So just let us know, reach out to us, and we'd be happy to help.
And thank you for having me. I really appreciate Lawrence and Ashley. And I'm at denverbody.com on all the social media. You can definitely reach out to us if you have any questions. You guys have a great day. I really do appreciate it. Thank you.
Thank you.
Thank you, everyone.
Okay, I'm going to go ahead and drop out.
Bye-bye.
All right. Bye-bye.